it's a special day. We're gonna be doing a new Foal exam. This filly is a little bit older. She's around 3 to 4 days old. But we're gonna show you what we basically go through when we see your newborn babies. So to start with, the first thing that we do is we just evaluate their mental status. So we just take a moment and evaluate the foal, evaluate their movements, if they're nursing, if they have like a strong suckling reflex, how they are bonded to the mom, and all these mental status. After that, we grab the baby, and what I like to do, I start from the head and then move all the way to the butt. So first thing that I do, I like to check the nostrils, make sure that there's no milk or any discharge coming out of the nostrils. Then what we check is the mucous membranes. They should be pink, they should be moist, and we check the capillary refill time. It should be around 1 second. One important thing that I like to check in the mucous membranes, especially there in the mouth, is to look for petechia that might indicate some sort of a systemic infection. After that, what we do, we check the eyes. In the eyes, we're gonna check to see if she has entropion, or if there's the presence of a cataract, or a small eyeball, any disease that we can find there. So we just use a little bit of a bright light to evaluate, and we just check. Next, we're gonna check the eyes again. We assess for entropion or cataracts or any defects that the eyes might have. We just use a light to assess for the entropion. We look at the eyes, we look at both eyes. One important thing to mention with newborn exams is that you have to be very fast and very thorough, because they don't like it. So yeah, we check for that. One thing that is important, babies don't have a Menas reflex. Actually, this reflex is, they learn it from their mothers. So after 2 weeks, like the first 2 weeks of life, they won't have a Menas. So if you go there and you start like trying to do it, they won't get the Menas response. So don't get scared if you don't see that in your baby. It's not the same as in the adults. Then we check the ears. Usually they are erect. I also like to check the tissue inside the ears, make sure they don't have any petechia. One thing we can also check in the mouth is the palate, to assess for cleft palate. There's nothing with this baby. So after that, I move to the thoracic cavity. I'm not gonna auscultate or anything. Right now, I'm just passing my hands. So I like to evaluate the chest. We assess for any rib fractures. So it's a quick check, where we just check for rib fractures. The most common ribs that get fractured during foaling are the first ones, like from rib 3 to the 8th. So we just assess that, like she's strong. We check the spinal reflex that is very present on her. After that, I like to check all of her joints. I just feel them. I assess for pain or for heat or swelling. So we just go through them very quickly, as they are not used to us touching them. And then what we're gonna assess is the umbilical cord, right? Well, the umbilicus. So making sure that it's dry, that it's not hot, painful, swollen, that there's not a hernia. With colds, we evaluate the inguinal area for hernias too. Now I'm gonna proceed to auscultate the foal. So we listen to the lungs, we listen to the heart, and the gut sounds. So when we listen to the heart, it's hard sometimes to get the actual heart rate. Normal in babies that are more than 1 day old is from 60 to 100, but what basically we're assessing is the presence of any heart murmurs. There are some heart murmurs that are normal in newborns, and we don't have to worry about it because they will go as they grow, but we assess for that. Then we check the lungs for any wheezes or crackles. And now we're gonna check for some gut sounds, make sure that everything's moving and it sounds okay. Okay, and last but not least, the most invasive part of the procedure would be taking their temperature. So we're gonna do that. Foals tend to run a little bit higher than normal horses, so their normal temperature goes from 37.5 to even 39. So it's a little bit more than horses. Perfect. So normal is 38.4 on this filly. So that's basically like a quick exam that we do on the newborn foal. After that, we always recommend doing a snap foal test that is basically to check IgG levels. This is just to measure the quality of the colostrum and the antibodies that they have in their system to protect them. For this, we just take a little bit of blood and we assess it with a quick snap test. It takes just 7 minutes and we can do it in the stall side. And this will tell us if they have good protection, more or less about protection, or not protection at all. And this helps us determine if the foal will need either more colostrum or running plasma, or if your foal is in danger of getting an infection. So feel free to check with your veterinarian. Now you know a little bit more of what we do and why we do it. And have fun with your babies.